Hello, I'm John Butler for Hypnotherapy Training International. Our next course is called Clinical Hypnotherapy, and this course is designed to take your hypnotherapy practice to a very high level of effectiveness. You're able, through learning on this course, to expand your practice by being able to deal with clients' deeper problems. By increasing the effectiveness of your hypnotherapy, by being able to go deeper into the origin of problems, the real nature and origins of these problems, you're expanding the range of problems that you can deal with effectively and safely. And all of this, of course, expands your practice base, and it builds an ever-increasing referral base because of the quality of the work you're doing. Being able to deal with difficult problems requires a thorough understanding of hypnotherapy, how problems develop in the first place, and having the range of clinical abilities to be able to deal with them. And that requires not just a limited ability based on some limited techniques. When you're dealing with deeper problems in the mind, they are embedded in the subconscious. They have very difficult elements sometimes that are deeply entangled together. And to be able to remove them means you have to use the same kind of power that entrenched them there in the first place. They are like deeply implanted hypnotic suggestions in the mind. And they've been reinforced over many years, conditioning of a very deep level. And so you need a therapeutic approach that goes to the heart of the problems, not a superficial approach. Now, in this course, you're learning a very deep understanding of subconscious power and how to use that amazing power for profound changes in emotions, in thinking, and in behavior. In the course, you're going to learn how clients get stuck and how to help them become unstuck, how to avoid the common causes of failure in therapy. And this kind of therapeutic approach, it doesn't produce or promise an instant miracle cure, although sometimes people feel much better after one session. It does a deep uncovering work into the subconscious with patterns that have been often developed within the mind over many years that need to be addressed. We need to be able to get into those programming instructions from authority figures, from people around them over the years that they've been exposed to. And so our therapeutic approach uses the subconscious power. This cannot be acquired by an intellectual understanding of problems. It cannot be acquired by just talking about those problems. Those things can be helpful to people, but you are learning in this type of training to uncover and reprocess the negative, even the traumatic events in a skilled and safe manner, so that you are able to help the person move forward in a limited number of sessions to acquire the power over those programs. Those programs can be changed. They have gone in there over maybe a long period of time, but once the subconscious power is activated and moving in a different direction, change can and does occur. And this training is based on real results, real work over many, many years. And it is involved the work of some of the most stellar people, physicians, psychiatrists, hypnotherapists from psychology, from the so-called non-licensed people in hypnotherapy who have also contributed a huge amount to the work that we do. So you're learning from the very best legacy, the very best practitioners. Now you're going to learn in the course about the therapeutic relationship and how this developed through hypnotherapy in a very powerful and special way. And the therapeutic relationship forms the basis of being able to do the therapeutic work. You'll also learn about self-hypnosis for yourself and how to help clients learn to take the power for themselves. You'll be accessing much learning. We have a great legacy of learning, as I was saying, to draw upon, while at the same time you're learning to express yourself uniquely as a therapist. You are learning to deal with what emerges in the therapeutic setting. And this is being able to adapt to what's happening, not just following some dogmatic, simplistic rules about how the therapy should be proceeding and how the client should be responding, when in fact, in your therapy session, the client may be responding in a very different way to what the plan was, to what was predicted by the therapeutic approach. And so we know that a competent therapist deals with what's in front of them, is not bogged down in therapeutic speculations, which are often not really based on real world interactions, but based upon people working from a therapeutic perspective that was largely theoretically based in an academic model, which can have some relevance, but often very little relevance to how you need to be able to perform in the real world. So learning to deal with what emerges, learning how to deal with clients' decisions to fail, the subconscious will to fail, to will to underachieve. These self-sabotaging patterns are very common in human nature. And you're going to learn a lot about how to motivate people, including yourself in this course, the power of motivation factors. You're going to learn so many elements about hypnotherapy that are taught in sufficient depth that you can begin to really understand what hypnotherapy is truly about and how it has given rise to modern therapeutic approaches of all kinds in the talk therapies, in psychiatry, and so on, in psychotherapy. So you are learning many skills and training yourself to become that flexible, adaptive, knowledgeable therapist that can truly deal with what emerges. I look forward to hearing from you if you've got questions, and hopefully seeing you on one of our courses, in particular our clinical hypnotherapy course coming up in May. Thank you very much for listening and watching.